I have seen illness and death on a scale that I have never seen in my career. I have admitted families. I've had to put spouses next to each other while one or both die. These are things that I have never had to do before.
My bias, I have no way of proving this, is that a lot of what we're seeing now is from Halloween parties and the trick or treating and things like that, where people, I mean, they were tired of being indoors. Halloween was a pretty night and they wanted to go out. And so they did. And now 14 days later, there's more COVID around. And a lot of people are asymptomatic from it, but can spread it. So I think Halloween was kind of a super spreader event.
I've had people who are not 60 or 70 that we have had to transition to sort of hospice care or end of life care because they caught the virus. We've seen so many healthcare workers across the country not just contract the disease, but also pass away from it. And I think this I can talk about because it was in national news. But there was a 28-year-old resident physician in Texas who caught the disease and passed away from it. And so there's certainly multiple cases of this happening to people. And I unfortunately have seen folks who I otherwise thought would do quite well fall very, very sick. And occasionally, unfortunately, some have even passed away.
But it's also a stressor strain to know that your friends and colleagues and patients may, in fact, be ill with COVID because the things that you see on the news are real. You know, people are getting very sick. So it's not just the stressor strain of taking care of people. It's that knowing that your friends and colleagues are some of those people who are receiving care or waiting on a test result. And I can only imagine, you know, waiting on the call from your doctor, like my patients have been.
Many folks are exhausted and overwhelmed. Um, we're concerned for our patients, we're concerned for our families, and we're concerned for ourselves. Um, with patients, when you look at the system being overwhelmed, it's kind of like when you go into a restaurant and when the kitchen's not working right and it takes forever for your food to come back or something like that. The difference is when we're dealing with patients, we don't get a second chance to make it right with you, because some of the things that happen, there are no do-overs.
Every night we deal with folks who don't believe they have COVID. It doesn't matter if you don't believe in COVID. COVID believes in you. So yes, from the very beginning of this, it has been disheartening to see what is essentially a common enemy for the world. When you think of a common enemy, you kind of think, it's time to put down our differences. It's time to work together.
People will say that this is real or not real. I've had patients who are on high amounts of oxygen tell me, what do I really have? I don't think I have COVID. And I don't know what to tell them. Sometimes I said, look, I gained nothing by lying to you, but we tested you for it. Your chest CT, the scan shows us that your lung has been affected by it. You're on a fair amount of oxygen. You're telling me you're working hard to breathe. Like, this isn't a lie. This is what's happening.
I think we have a duty. Certainly as a physician, we're asked to first do no harm. So I try not to be judgmental to individuals who are delivering care, whether they're a physician or a nurse or respiratory tech or medical assistant who might voice their doubt about what's going on. I have run across some of those individuals, and I have tried to listen before acting on what I'm hearing. But certainly knowing people and taking care of people who've become very ill from COVID, and knowing that it is very real, it is very disconcerting when individuals who are meant to be taking care of others are doubting what's actually going on.
It's exhausting. It's exhausting to hear the different disinformation, and all the things you have to deal with outside of work. And then, whenever we go to work, we try to be, present and there for our patients. And, especially in these COVID units, they're very, very sick and they require lots of care. And they decline very rapidly.
It's very hard to take. I mean, it's like when you wear a mask or not, it's become a political statement. and people have become angry and acted out about it. I mean, at least I'm seeing in the grocery stores, people really wearing masks now because they can't get in the door without one. But otherwise, when this first started, you would see it. And we had signs on our neighborhood that said, "You are a hero, thank you." Now, there was some information out that we were diagnosing COVID because we got more money for that diagnosis. I mean, how ridiculous is that?
And even then,
The spread of the coronavirus in China and around the globe has dominated headlines, which is causing a personal dilemma. I have 2 tickets to Taiwan and lots of questions. Is it safe to be traveling internationally right now? How serious is the threat of the virus? Or are these just unfounded fears, fueling an unfair stigma around traveling to Asia in the first place? To get answers for these questions, I went straight to the experts, doctors at the Ohio State University Wexner Medical Center in Columbus, who are well-versed not only in the pathology of infectious diseases, but in public health policies for outbreaks. First, we talked to Dr. Christina Lishaneski. She's an assistant professor of internal medicine in the Division of Infectious Diseases. In other words, if there's anyone to address fears about viruses, it's her. What kind of questions should people have or consider before they travel to countries that do have the coronavirus?
Sure. So I think probably the most important thing really is you should consider your own immune system. So people whose immune system is not normal, so people on chemotherapy, who've had transplants, who are really young or really old, their immune system is probably a little bit more hampered, and if they happen to get infected, they would have a sicker infection. They would be sicker.
So when it comes to traveling internationally, the questions basically come down to this: weighing unnecessary panic versus legitimate concerns.
So anytime you make a decision in your life, there's always a risk benefit, right? So it depends, why are you going? How important is it? Is it something that can be postponed or not? What's my immune system like? If I happen to get sick, how will I be able to handle it? What's the healthcare there? So those are all things that I would personally consider if I was taking a trip.
The numbers are continually changing, but as of this week, the World Health Organization reported more than 81,000 cases of the coronavirus worldwide, compared to just 12,000 on February 1st. China has the vast majority of cases, while the U.S. has more than 60 confirmed cases of the virus, and Taiwan, with a population of 20 million, has 30 cases. Meanwhile, the CDC is issuing travel warnings. The highest warns against all non-essential travel to China and South Korea. A level 2 alert has been issued for Iran, Italy, and Japan. There's no warning against travel to Taiwan. However, the CDC has labeled Taiwan as a destination with a risk of community spread. So those are the stats to consider when it comes to Dr. Lishaneski's risk-benefit analysis. But I also talked to Dr. Andrew Thomas. He's the medical center's chief clinical officer and leads a campus-wide collaboration to make sure everyone stays informed and healthy during cases of new potential outbreaks. As Thomas explains, there's something else to consider when traveling internationally: the possibility of a quarantine.
But also there is a concern of what then happens when I come back. If I have to self-quarantine for 14 days, I can't go to work, I can't go to school. Those are really practical considerations. But if someone was going to a part of China where there was a low percentage of infections and they were going to visit a sick loved one, I mean, there's reasons why people may still need to go. They just need to understand that between the CDC, the Ohio Department of Health, and the local public health department, they are going to be asked to do something very different when they get back from vacation than they probably have ever had to do before.
In fact, this week, the Ohio Department of Health reports 212 people went into self-quarantine for 2 weeks after coming to Ohio from China. But along with tracking the latest news on the coronavirus worldwide, Thomas is also working with university officials to reduce panic. This goes back to the question I had earlier about an unfair stigma. He says unnecessary panic has the potential to spiral into discrimination.
There was a lot of concern that people would, whether in what they say or in how they treat others, start to do discriminating things against people that were Asian. not wanting to go to Asian restaurants, not wanting to sit next to an Asian student in class. And obviously there's very little need to do any of those things. So trying to reassure the 99.95% of people that haven't been to China that they have much more to worry about with influenza than they do with coronavirus.
Another component to consider is the impact the virus is having on attractions. While it still seems like Taipei's famous night markets are still up and running, there are cities and countries that are restricting large gatherings and events.
This year has been tough for the Hunter family of Stowe. Michelle's mom, Donna Cook, has been in an assisted living facility there.
And we would go on Wednesdays and have cookie night with her, and then we would bring her to our house and on the weekends. And then in March, when everything started shutting down, it became very difficult. We couldn't see her first of all. And then when we could see her, it was trying to coordinate with window visits and the telephone. And so it's made it a lot more difficult and hard on all of us.
Michelle's daughter, Allie, says it's clear the pandemic has taken a toll on her grandma.
I could just tell it's hard for her because before we were able to see her and we were able to bring her over and she could spend time with us and eat and stuff like that. But now that she can't spend any time with us, she has no one to spend time with. She used to have a roommate, but her roommate passed away and she hasn't gotten a roommate since. So it's pretty lonely for her. You could just tell when you go over to see her, she is depressed sometimes.
She's not alone. Pam Fry's father, Stephen Miller, is in a memory care unit in Stowe, and her mom, Virginia Miller, is in assisted living.
We have not seen my dad since March. We've done a few outside visits, but every time the state goes to a orange, they stop all visits altogether. We can't even right now do window visits. We're not permitted to take food to my mom. All we can do is take her things that they can wash down with, sanitizing wipes. We couldn't take her Thanksgiving dinner. She couldn't come out for Thanksgiving. We couldn't visit through the window. My dad, what's really hard with my dad is, he has Alzheimer's, so he doesn't understand a Zoom meeting or a video call on a phone, or he doesn't understand it. So he gets very frustrated. And it's sad because we don't know when we can see him again.
The upcoming holidays make the situation worse for many families. Don McCann's mom, Marta Fromm, is in a skilled nursing facility in Delaware. He says she's missed coming to his house for Thanksgiving and has questions about the Christmas tree the family usually sets up in a room.
Why am I not getting my Christmas tree put up? Why am I not getting my Christmas tree put up? And I got to keep explaining to her mom, because we're not allowed in the facility right now. I said, you can ask. And so she did ask Willowbrook, but they don't go that far to be digging people's decorations and all that kind of stuff out. They have decorated the facility, I think, but not necessarily. But mom likes to have her Christmas tree in her room. So that's been a toughie.
COVID has been tough on nursing home employees, too. It's been widespread among staff and residents in many facilities.
The staff are overworked, spread very, very thin. We also have, turned into an extended family for our residents. Their families aren't there daily to see them and spend time with them. And the people that they are used to sharing their daily lives with are no longer able to come in to see them any longer.
In a news conference with Governor Mike DeWine, Watkins explained the emotional stress COVID is taking on nursing home staff. She told a story about a nurse who came back from maternity leave and found half of the residents she had cared for had passed away.
And they didn't get discharged home. They didn't go to another room. They were gone. And the pain and the emotion that I saw in her face coming back to that when not being there during that time was devastating.